Hi, welcome to BizTech's Health and Wellness Show presented by IJN, the National Heart Institute of Malaysia, the show where we focus on equipping you with the knowledge on health and wellness to help you ensure a more productive and healthy life for yourself, your family, and your employees. Hi, I'm Dr. Selina, and I'm your guest domain host today. And today, the conversation is about chiropractic care. To bring insights on this topic, we have Dr. Randeep Manocha, who's a chiropractor. Welcome to the show, Dr. Randeep. Hi.
Hi, Dr. Selina. Thank you so much for having me.
Dr. Randeep, would you like to give us a bit of an overview on the overall chiropractic industry and how the awareness and relevance of it today?
So chiropractic, so I started practicing as a chiropractor in 2015. And overall, I think people are becoming more aware, definitely. They're becoming a lot more accepting of chiropractic. And so I give you an example. When I first started practicing as a chiropractor in 2015, a lot of my patients who came through, I actually had to explain what chiropractors are, first and foremost, how we're different from medical doctors, specialists, physiotherapists. So there was a lot of that going on when I first started in practice. Nowadays, a lot of patients who come into my practice, they sort of have an idea what chiropractors do or when to see a chiropractor. So it's definitely becoming more accepted throughout Malaysia, and people are slowly starting to become a lot more aware. And I guess we have social media to thank as well, because a lot of patients who come in have probably seen something over Facebook, Instagram, or YouTube. So like if you compare now versus 5 years ago, I feel like acceptance is growing and people are slowly starting to become more aware of chiropractic.
Okay, so what are your thoughts on the level of education of Malaysians towards this industry?
So I think, so like I said, I think awareness is growing. People are definitely becoming more aware, but I feel they need to be more educated to some extent as well. I think it's definitely necessary. And here's the thing: I feel like education, it should be focused. Like the medical professionals should also know what chiropractors do, not just the public. So in terms of when I mean education, I mean like what are the kind of treatment that chiropractors offer? When should a medical professional refer to a chiropractor instead of a physiotherapist or a specialist? So minor things like that. So even though Malaysia or the public is becoming a little bit more aware, but I think there's definitely room for education.
Okay, just now you did mention physiotherapy, when like a doctor should know when to refer to a physiotherapist and when to a chiropractor. So how are they different?
So in Malaysia, a lot of the physiotherapists that you get in a hospital setting are being referred to. They're not the primary contact practitioners, unless of course you go and see a physiotherapist outside in a like a private physiotherapy clinic. Say you've got back pain, for example. So if you see a specialist or a GP and they feel that you need some physiotherapy, then they're the ones that are going to refer you to the physiotherapist. So that's one of the few differences between like chiropractors and physiotherapists in Malaysia. Whereas a chiropractor, you can see a chiropractor as like primary contact. So you can go into a chiropractic clinic, get diagnosed. Chiropractor will do a proper history and physical exam, probably send you for some imaging if you need to be sent for any imaging, and then receive treatment there as well. So that's one of the few key differences in Malaysia between chiropractors and physiotherapists.
Which kind of patients should go to you? Which kind should go to a physiotherapy? How does, say, a patient, or if I'm a client and I need some of the services, how would I know who to go to?
So my advice to patients when they ask me that is, if you're having any form of musculoskeletal pain, joints, muscle, say for example, lower back pain, you can go see a chiropractor and you would probably receive some care unless the chiropractor does a physical exam, does imaging and says like, look, okay, you probably need some stretching and strengthening exercises. You need a lot of muscle work. I'm going to refer you to the physiotherapist. So for any sort of musculoskeletal pain, you can see a chiropractor, whether it's knee pain coming from like arthritis or knee pain coming from like, say you're a very physically active person, you sprained your meniscus, things like that. You can go to a chiropractor for any of those things. If you require a referral for extensive rehabilitation, then most likely you would get that in a physiotherapy setting, in which case the chiropractor would refer you off for that.
So basically, if I have any pain in my muscle or my joint, I can just come and see a chiropractor, and then you will do a thorough examination, and then you send me for X-ray or MRI and that sort of thing, and then you will refer me to a physiotherapy if needed. Is that it?
Correct.
Okay. So what are the like common misconceptions surrounding chiropractic practice? I mean, for instance, for me as a doctor, I'm also not very aware of what chiropractors do. I know my parents think of them as masseuse. So what are the common misconceptions that you get?
In terms of mistaking what I do for massage or things like that, yeah, that used to happen quite a bit initially. But I guess some of the very few misconceptions are like, so you've probably seen some videos of chiropractors doing what they do, right? So there's a lot of clicking, cracking. We call that manipulation or joint manipulation or an adjustment. So whenever we manipulate certain areas that are a little bit scarier, like for example, the neck, I get a lot of one of the misconceptions is that if you adjust the neck in a wrong way or too rough, you could instantly die right then and there. It's to kill someone, by breaking a neck or what you see in the movies. It's actually a lot harder than it looks. Not that I've tried, but there are a lot of other structures like the joints, ligaments, and all that holding your neck in place. And chances are, if you do go for a neck adjustment, it definitely very scary, but very, very safe as well. So that's one of the things. And then the other is that, so some patients have come to me saying that, oh, I've got a misalignment in my back. Like the position of the vertebra is out of place. I need you to push it back in. Or I've got a disc injury.
The spine is out of line?
Yeah, so that's one of the misconceptions. If they're having some sort of backache or a certain muscle is bulging a little bit because it's very, very stiff. So that's what they come to me with. My position is out of place, bone is sticking out. Can you just push it back in? So then I explain to them that anatomically it's impossible. Like if a vertebra is rotated and you see a chiropractor, he's not going to push it back into position per se. Or if you've got a disc injury and the disc is pinching on the nerve, you see a chiropractor, he's going to push the disc back into place. No, it doesn't work like that. The type of treatment we do, yes, it helps relieve pain from disc injuries, things like that. But it's not as simple as pushing a disc that's sticking out back into place. Anatomically, it's not really possible. So that's just some of the misconceptions that we hear coming from patients or the public.
Yeah, I guess that's also what a lot of my elderly folks would say, that, oh, you just go to the chiropractor and then they push your spine and straighten it for you, right? Yeah. Yep. So just now you mentioned something about, doing the manipulation around the neck. Like what are the approaches that you use to ensure that it is effective yet it is safe?
I'd say the devil is in the detail. So there's nothing, like in terms of my approach to make sure that it's safe and effective, it's nothing more than a proper history, a proper physical exam, and sending the patients for appropriate imaging or blood work if necessary. So it's honestly, there's nothing simple about it. I image 95% of all my patients who come in, especially if they have pathology involving the spine. And it's as simple as that. If you do a proper history, physical exam, you send the patient for the appropriate imaging that's necessary, you can diagnose the patient very well and recommend the appropriate treatment.
Okay, so let me get it straight. So that means if there's any issues with the spine, for instance, if they come and see you, you would you will do the proper, you will ask them what's going on, and then you do a physical examination, and then you send them for a scan, let's say an X-ray, an MRI or something, and then only you will proceed with your treatment.
Yep.
Okay, so what does the treatment involve in chiropractic? Let's say if I had scoliosis, for instance, how, and if I came to you, and how would the process be like?
So if someone came to me with a scoliosis, let's assume a teenager, I would send them, do the proper history, find out if they're getting any pain as a result of the scoliosis, do a physical exam to assess movement, or any challenges that they might face as a result of the scoliosis, and then finally send them for an X-ray to assess the spine, maybe measure the curves. And then, depending on what I find, I usually put most of my scoliosis patients on a course or a program of joint manipulation or adjustments. That's one. Two, I have at my workplace, I'm fortunate to have some physiotherapists working with me who are very good. And I sit with the physiotherapist. We put together an exercise program based on what our physical exam findings are, what our X-ray findings are. We put together an exercise program, and we explain to the patient that, hey, look, this is your scoliosis. This is the exercises and number of exercises you need. You have to do these exercises at home. If the scoliosis is quite significant and I find that they need a scoliosis brace, then we'll recommend one and we'll fit them with a brace as well. So in short, most of my scoliosis patients, we do scoliosis specific rehab and adjustments. If it's quite significant, I feel like they require a scoliosis brace, then we order one for them. And the thing about specifically scoliosis is that it's not a short term, it's not a condition that's like back pain, for example. We treat you for back pain and then we send you off. Scoliosis requires monitoring. Like I send some of my scoliosis patients for X-rays every 4 to 6 months. Every 4 to 6 months to assess the curve, see if it's getting any worse, or if what we're doing is working and we don't have to change the treatment plan. So scoliosis is one of the conditions that that we need to pay very thorough attention to, and it requires a lot of follow-up until the patient is almost done growing.
I see. Is it curable?
It depends how you define curable. Some of my scoliosis patients, they come in, they have a curve, a mild one, but they're getting a lot of pain as a result of the curve, myofascial pain. So for patients like that, they're not interested in getting like their spine completely straightened. They want the pain to go away. They're more worried about the pain. If you're asking me whether with chiropractic treatment and physiotherapy, a spine that's an S shape can become completely 100% straight, in my experience, that's very, very unlikely through chiropractic and physiotherapy. But if they're looking to get rid of certain things like pain, improve a curved spine to some extent, reduce the curve, then yeah, things like that, very, very possible through physical rehab and chiropractic treatment.
Okay, so do you think a perfectly healthy individual should, regularly see a chiropractor, or only those that are, who are injured and facing pain that should be seeking a chiropractor?
I was just speaking to my friend about this the other day. Very physically active guy. He was getting a little bit of neck pain, and so he came by and did a little bit of work on his neck. So we adjusted him, did a little bit of stretching and strengthening, and he felt 10 times better. He wasn't exactly someone I would consider suffering from a lot of pain or he's got a condition that requires urgent attention. But here's the thing. If you see a chiropractor regularly, things like exercise, aches and pains from exercise, or your regular gym goer, or you're a mixed martial artist, or you enjoy participating in mixed martial arts. There are a lot of ways that chiropractic can help lessen the incidences of these aches and pains and improve your performance. And there's significant evidence to suggest that as well. So you may not necessarily require the same attention that a geriatric patient would require in terms of relieving yourself of pain, improving mobility, things like that. But everyone can benefit from chiropractic to a certain extent. How much? Well, you've got to see your chiropractor, get an adjustment or two, and see how you feel afterwards.
I see. So it's somewhat similar to servicing your car every 6 months.
Exactly, precisely that.
Okay. So what local providers or the government can do to help the masses to get this treatment that they require, considering the fact that chiropractic help is needed more than ever?
I think education is very important. Right now, chiropractors are only available in a private setting. So if you go to government hospitals, government health clinics, anything that's government related, you're not going to get a whole lot of exposure to chiropractic. There's nothing that you can go receive at a government health clinic, for example, that would educate you on chiropractic. So I think if local providers or the government could sort of educate the public on very, very basic things like what chiropractors do, when could you go see a chiropractor, that would be tremendously helpful. Social media has helped to a certain extent, but of course, if people were looking for a service that isn't available in government clinics or government hospitals, then they're not going to get any by speaking to anyone from a government clinic or hospital. So I guess the government could help chiropractors out or educate the public through that sense.
Yeah, I think you're completely right, because as a person who has worked in the government service for so long, I've never came across any chiropractor in the government hospital. So the future of the industry as a whole, what do you think the upcoming challenges and potential market gaps are?
Well, right now, I personally still think that chiropractic is a growing profession in Malaysia. We've got one university in Malaysia and Southeast Asia, I think, where chiropractors, where people could get a formal education. So that's IMU, International Medical University. So any local graduate is the only place that they're graduating from is IMU. So it's not just as a profession as a whole. It's not just we require chiropractors to service the public. We need educators, people who are very well versed in chiropractic research, and as well as practicing chiropractors to service the public. So as a whole, I think it's still, chiropractic is still at its infancy in Malaysia. I think there's so much room for growth, especially in all of these aspects. Some of the challenges, I guess, public acceptance is good, but like I said earlier, there are a lot of people who still don't know what chiropractors do, especially medical professionals, GPs, medical officers. A lot of them still don't know what chiropractors do, or how chiropractors can help the public. So in terms of awareness and education, I find that to be quite a challenge. If that can be overcome, then I think you'll see the profession grow a lot better. Like the growth will be tremendous, and a lot of people will start getting exposure to chiropractic overnight.
Any final thoughts, Dr. Randeep, that you'd like to leave us before we end the conversation?
I think if you've never been to a chiropractor, I think it's definitely worthwhile you go to a chiropractic center just to experience it. Or if you are getting significant neck pain, back pain, or any joint pain, then consider giving chiropractic a shot. The chiropractic has been around and has been growing in Malaysia for a number of years now. And to put it simply, a lot of people are very happy with the service we provide. So if you haven't been to a chiropractor, go check it out.
Okay, thank you for taking your time to be on the show, Dr. Randeep. I'm Dr. Selena Chu, and we've been speaking to Dr. Randeep Singh on this Health and Wellness show presented by IJN. This video and podcast will be on BizTech's social media platform as well as the website www.biztech.asia. Please subscribe to all our various platforms. Thanks for tuning in.